Welcome to our channel HASHMICLINICS.
Hello and welcome. In today's explainer, we're going to do a clinical deep dive into a really fascinating and, I think, often underutilized remedy, APOCYNUM ANDROSAEMIFOLIUM, also known as spreading dog vein.
So let's just jump right in with one of APOCYNUM's most peculiar and honestly unforgettable keynotes. It's this sensory illusion where the patient tells you that everything smells or tastes like honey. This strange, sweet perception can be such a powerful entry point to the case, and it's one of the most reliable guides you'll find for this remedy.
Here's how we're going to break it down. We'll start with the remedy's core identity, then we'll build out the guiding symptom picture, look at its clinical uses and modalities, and wrap up with some key prescribing pearls that you can take right into your practice.
Okay, so what's the central disturbance that APOCYNUM addresses? What's really going on here? Let's get to the very heart, the genius of this remedy's action.
So this remedy comes from the Apocynaceae family. That's the same family as strophanthus, which is a big clue. It has this really profound action on the neuromuscular system and on serous membranes, which right away explains its strong affinity for joints and the linings of our body cavities. And we're using a tincture prepared from the fresh root, which really harnesses its most potent properties.
Now, if you remember nothing else from this whole explainer, remember this one sentence. This is the one-line summary. It's a premier remedy for those wandering rheumatic pains that come with stiffness, swelling, trembling, and a really deep, profound exhaustion. This is the central state that everything else revolves around.
All right, let's take that core idea and start building on it. We're going to layer the characteristic symptoms on top of this essence to create a complete patient portrait that you'll be able to recognize. And we'll start with an area that's often overlooked, the mental and emotional state.
You know, we often think of APOCYNUM for its physicals, but the mental state is absolutely key. The patient is often low-spirited, nervous, sometimes feeling completely bewildered, like they just can't think clearly. And this isn't just a reaction to the pain, it's part of the remedy picture itself. In fact, you'll often see the mental symptoms alternating with the physical complaints. And pay close attention to that peculiar mental illusion of swelling. It's like their mind is mirroring what's happening in their body.
And here you can really see how its action plays out across the whole body. The weakness isn't just tired, it's a deep prostration that comes with trembling. The pains have a characteristic direction. They move downwards. On top of that, you get this violent left-sided facial pain. And, of course, that signature digestive complaint. This explosive vomiting and diarrhea that, and this is the strange part, makes the patient feel so much better.
Now, this is absolutely crucial. The thing you have to understand is the mobile, migratory nature of these pains. This is what really sets it apart from remedies where the pain is fixed. The patient will tell you the pain was in their shoulder, and now it's in their knee, and later it might be in their toes. And it often comes with this feeling of drawing or pulling in the muscles.
And here we have a really powerful confirmatory keynote. It's very much like what we see in sulfur, and it's something you should always ask about in a potential APOCYNUM case. This burning of the soles, this violent heat, especially when it comes with perspiration that forces them to stick their feet out from under the covers, that's an unmissable sign.
Okay, so practically speaking, where are you actually going to find yourself prescribing this remedy in your day-to-day practice? Let's look at its main clinical applications. As you can see, the range is pretty broad. It covers these acute inflammatory states like rheumatism and gastroenteritis, but it also gets into more chronic, sluggish conditions like dyspepsia and dropsy. And its ability to expel things like worms and renal gravel really highlights its powerful eliminative action on the body.
Now, to really nail down the prescription, we need to understand the modalities, what makes the patient feel better or worse, and how APOCYNUM stands apart from some of its closest relatives.
So take a look at this. Notice the strong aggravation from anything to do with the left side, and also from breathing, which points right back to its involvement with serous membranes like the pleura. And there it is again, that peculiar, almost bizarre relief from purging. It's a cornerstone of its gastro-rheumatic picture.
This table is super helpful for telling it apart from other big rheumatic remedies we often rely on. I mean, they all address joint pain, right? But APOCYNUM's wandering nature, that honey sensation, and the hot soles, that's a unique combination. Bryonia. Well, Bryonia is all about aggravation from the slightest motion. And with colchicum, you're looking for that characteristic profound nausea from just the smell of food. Okay, to make sure all of this information really sticks and is easy to apply, let's summarize with a few powerful memory aids that you can take with you. Think of this as your 5-step checklist. When you suspect this remedy, just run through these points. If you follow them sequentially in a case, it's going to lead you to a much more confident and accurate prescription. It really provides a solid framework for your case analysis.
But if you only take one thing away from our talk today, let it be this. This is the unmissable triad. When you find these 3 symptoms together in a single patient, the wandering rheumatic pain, that honey sensation, and the burning hot soles, you have to think of APOCYNUM ANDROSAEMIFOLIUM. This combination is an incredibly powerful, almost definitive confirmation for the remedy.
So, I'll leave you with a question to think about. In which of your chronic, unresolved rheumatic cases might you have overlooked this remedy? I want you to consider its unique profile in your next challenging case of migratory arthritis or neuralgia. It just might hold the key you've been looking for.
Professor Dr. Rifat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of materia medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rifat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.